Hello, I'm Tracy Lumbasi, founder and CEO of Believe Mental Healthcare Organization. Believe Mental Healthcare Organization is a community-based organization in Uasin-gishu, Kenya. We operate in Eldoret town and the other wards around Uasin-gishu County. So we deal with mental health and culture conversations and projects. And currently the project that we are doing, we are addressing gender-based violence. With the corona pandemic, social inequalities have been highlighted, and the most vulnerable people in our community, that is children, women, and young boys, are being abused and their rights are being violated. So from the scenario of gender-based violence in Uasin-gishu, it's quite big and comprehensive. A lot of factors are involved. And as a community organization, we address comprehensively the social, cultural, economic, and political issues relating to gender-based violence. And political issues in these terms are the policies, the structures which are in place in the county government, the leadership in preventing and in responding to gender-based violence. Yeah. That's what we do.
Areas of concern, perhaps?
So the areas of concern when it comes to gender-based violence scenario in Uasin-gishu, it's where we don't have sufficient services providers in the response pathway of responding to gender-based violence. The medical services are okay, everything is in place, the structures are good, and maybe they need support. This is resource support, financial support, capacity building support. And when it comes to the counseling, there are a lot of individuals and organizations handling that. Justice and legal, we have organizations providing free legal aid. And for the justice part, that's where it's lacking, because there are some wards that they don't have gender and children offices. And also the available gender and children offices, they're handling a lot of cases. So we are hoping with the pandemic highlighting these issues, we might have a devolved structures, devolved mechanisms in the gender and children offices at the police stations. Another thing is that police officers, they lack also resources, like cars or vehicles to go and respond to a case with our road structures. So you understand, they lack facilitations. This is airtime. They're dealing with the kids. They're the ones dealing with the kids on the ground. The children might need fare. They might need to be removed from an abusive environment, and they don't have that facilitations to do it. So there's no fund to support this. Yeah. And when it comes to livelihood services, I don't think Uasin-gishu has any organizations or institutions catering for that. And in terms of shelter and security, they're minimal. The services are not comprehensive and adequate. They're not well resourced. So that's the scenario that we are facing and the concerns that we have.
Who are the most vulnerable in terms of SGBV within the county? In
the county, children and women, they're the most vulnerable. Yeah.
What is the role of culture in navigating these factors?
It's a lot. It's the role of culture and social norms. I feel that they're ones pushing for gender-based violence. The thing about gender inequality, the expression of masculinity and femininity. This is something that's affecting the LGBTQ community in Uasin-gishu, and their rights are being violated. They're being harassed. They're being assaulted. The thing about these rigid and strict gender norms and roles, they're also perpetuating violence, especially in relationships, in households. And the most common forms of gender-based violence that we are seeing, it's the intimate partner violence, sexual violence, and financial abuse and economic abuse, especially, and these are being directed to women and children. Yeah.
You are taking basically whole issue. Your names and designation.
Yeah, my name is Sharon Jalagat. I'm the programs manager of the Believe Mental Health Care Organization.
Targeting how many people?
We are targeting 5,000 women and girls who we can help. Yeah, according my view on GBV, Uasin-gishu County has been on the rise lately during the pandemic on GBV. As you can see the statistics, 43% of girls, that's teenage girls, that's between 15 to 19, have experienced gender-based violence, while 47% of married women have experienced gender-based violence. That's a very high percentage. High percentage of women and girls experiencing the gender-based violence. And our objectives in our organization, we want to create awareness of gender-based violence in our Uasin-gishu County. We want to capacity build the community of how to cope and respond to gender-based violence in our county. And also we want to promote the response and facilitate the prevention of it. Yeah, to community level, because that's where it's happening, and the first response should be the community. Yeah, that's what we are focusing on.
Do you have safe homes for these people who are abused within the county?
Yeah, we've created networks. We have safe homes. Where we can take them for livelihood. We have networks for legal system. We have for medical, like here, county hospital. Yeah, we've created networks where in case we have a case, we can work with it swiftly. Yeah.
How many of them can you say now are under the safe homes within the county?
Within the county, now we have only 2 cases which we've worked on, and yeah.
Any most extreme case that you've received as an organization?
Extreme cases
that you can note out?
Yeah, we have one where we have a girl who was raped, and we are still on the process. We are working on it. Yeah, and we are 80% almost done with the case. Yeah.
Is there a correlation between SGBV and unsafe abortions that we're seeing being reported? You're told in 1,000 cases you have 64 abortions, unsafe abortions. Is there a correlation between the two?
Yeah. There's a very big relation, because gender-based violence include rape. And when someone is raped, there's a lot of shaming. You know, girls have been taught, like, when you're raped, it's very shameful. You can't even talk about it. You can't tell anybody that's your problem. You're the one who caused the rape to occur. So when they are raped and they are big enough reproductive age, they tend to keep quiet about it. And when now pregnancy comes, because they can't go to legal systems, or they can't tell anybody, like, I'm pregnant and I'm not comfortable about it, they tend to go to do unsafe abortions. Yeah.
How do you categorize most of your victims? And what category are they? Those who are schooling, the university students, women who are married? How do you categorize them? Most of your victims?
Most of our victims, we categorize them with age.
No, I want to understand. Most of the victims that you're working with, who are they? Are they students? Are they those who are young married couples? Who are they? To help us understand, or it's just a mixture of them all?
Yeah, we work with them. We work with teenagers and young women. Yeah.
Any areas that you feel the experts need to do much into? Are they getting the counseling that they deserve?
Yeah, with reported cases they're getting, but not so much. Yeah, there's lack of counseling, and it's being underdone, I think so, because only those who report their cases are the ones who get counseling. They forget, like, in the communities or somewhere in between, there are people who have undergone this gender-based violence and they keep quiet about it, and they can't talk to anybody about it. So I think it's good if we can't just sit here and wait for the cases to come, but you can walk into the communities and just give them counseling, just capacity build them about the stuff, how they can respond to these things that they happen, the pathway, how they can handle it.
Do you feel that the reported cases could be having more unreported cases out there?
Yes. Yes.
She mentioned something to do with culture. We have, if you come from this region, there's something we call kipka. Especially when it comes to the defilement cases, and how is it affecting the whole thing? about the rights of the LGBT victims?
Yeah, it really does. Culture. Culture has been rooted so deeply that people believe that there's nothing beyond culture. You have to stick to culture because that's the livelihood they have. And it has really affected the outcomes of gender-based violence. For example, let's say in a marriage setting, they say a woman can't be raped. A woman can't be raped because you're married. So anytime you can't say that you've been raped, or it's expected that a woman, if you're beaten by your husband, it's just okay. It was just disciplining you or reminding you something, which is not okay. But in the culture, it's like, so if your husband has beaten you, it's your mistake and you have to look for what you've done wrong and correct it. But of which sometimes it's not even your mistake. But even if it's your mistake, that's not the right way to handle the issues. Yeah, so culture has taught people that if your husband has beaten you, it's just okay. There's no saying no in a marriage when it comes to sex or something. And that's not it. Yeah.
Awareness, finally. Are we doing enough in terms of creating the awareness?
Yes.
The leadership, our leaders, our political leaders, the clergy, are they doing enough?
Are they doing enough, really?
Especially in terms of creating the awareness regarding this retrogressive culture and whatnot.
No, I don't think they're doing enough.
Maybe a shout out to them as a way forward, perhaps.
Yeah, our leaders, I don't think they're doing enough addressing the gender-based violence, because if they could be doing enough, maybe they could just set up in a community what? Let's say a community safe place where in case someone faces GBV, he or she can go to the place and get help. But now you see the pathway, someone, let's say inside the slums, faces GBV, he or she'll just see that it's a lot of work to come up to places like this to report the cases, because maybe they lack transport, or it's a lot of, and what they call, when you come to the offices, these leaders or workers, they demand, let's say, kitu kidogo, like they normally do, especially maybe the policemen. So you come and report, and they say kitu kidogo, or else your case will not be worked on. And now there's nothing they can do, so they just go unanswered or unresponded to. I think it's high time they create these safe spaces in our communities, the lowest level, that's the community, so that it will be easier for them to deal with the issues. Yeah.
Sijui tusongea na wewe sio? Leo tutazungumza zile kesi ambazo mnapata mara nyingi hapa ziko namna gani ukilinganisha kwa mfano mwaka huu na miaka ya nyuma, kuna tofauti ambazo zimepatikana?
Okay, yes, my name is Susan. I work at the district hospital. I'm a clinician, a nurse at the clinic of SGBV. Yes, cases are there for SGBV, and especially now there is a rise because the children are at home, even the students, and there is a lot of pressure because of the epidemic, and so people are at home, so there is a lot of problems, and students and children are all over. So yes, cases have risen. Yes.
This office, was it in existence some years back?
Yes, the clinic started since 2014. So we've been running the clinic since then. In the county, we have all the county hospitals are sensitized on the same. So they also attend to our clients when they go to their clinics. We also have referral, MTRH, where we have the clinic like this one also. So when we get cases which we cannot handle, we have a referral to refer. And then a client decides where to go, can decide to come here, can decide to go to referral, can also decide to go to the other county hospitals which we have sensitized, and the sub-counties.
Since 2014, how have you been seeing your clients so far? Are the numbers rising? How is stigma, how is sensitization at the community level regarding these cases?
Yes, I would say the sensitization is not enough, because what we feel is that the community needs to know what they are supposed to do. Is when any of the cases comes, either it's rape or violence, they need to be sensitized to what to do. Why I'm saying this is because, like, in most cases, you find if there is like physical violence at home, in most cases they report it to the mzee wa mtaa or the chief. And so when they go there, then mzee wa mtaa is not a clinician, is not a police, and at times even them, they are not sensitized enough what to do. And so in most cases they go and they start talking to them on how they can reconcile and continue. And maybe even they finish there, they even sometimes don't come to the hospital. And the same case also to the rape. At times they can also go to the chief, or even is settled at home. Because in most cases, like the sexual, usually it is within the family or the neighbors. So in most cases, the perpetrator is usually somebody who is known to the family. And in most cases, they settle at the family level. So they don't even come for the treatment. And even for, maybe even there was a physical and there was a problem. So there is no enough sensitization. That is what I would say in the community. So what I would recommend is that there should be more of sensitization to the community, and more so even to the schools, because like especially the students and small children, they even don't know, because parents at times they are not very close to the children to tell them what happened. And so when something happens maybe at home or even at school, they may not report. So I feel that it should start, there should be set up the programs to visit the schools and go and do the sensitization. Also in the community can be done. We can be included of the same to go and give the sensitization to the community, to their maybe groups, the churches, the meetings, so that everyone should be sensitized on what to do when these cases arise. Yes.
Some of the most common cases that you receive here, and how many do you receive in a day of these cases?
I would say over a month. Like a month, we can get at least 10. And as I have said, that we in all our sub-counties hospitals, they attend the same, and even our referral hospitals.
The most common forms of SGBV that you do address here?
The most we attend to, usually they are sexual and also the physical. They are almost equal. And at times, they might not even come to us, because this is a clinic, a special clinic, and we have clinicians within the hospital. In most cases, in our setup, before they come to us, they have to go through the clinicians, our clinic officers. So at times, they are attended to, and they don't refer. So we miss them. They are in between. They come and they are treated, and they feel like it is over. And so they go. So if we can say whatever the number we have is what we are supposed to, we cannot say it's exactly the number within the hospital, because we miss them between our special clinic and where they are seen from. Yes.
Finally, what is your take regarding sexual violence, especially amongst inmates? We've had reports of sexual violence among inmates. I don't know whether you've addressed some of them. Mm-hmm. What could be done to help them? And also among the LGBT community, do they come for services?
The inmates, rarely. Why I wouldn't say that it doesn't happen, because we just know so well that these things happen in the inmates, but less of them are reported, because maybe the prison warders, they don't come to get to know. And even if they come to know, maybe they don't seek for treatment. At times, maybe they may think that it is not important. And more so others, even for stigma. Like maybe if it is sodomy, very rare. For men, it's a stigma. Even at our own clinic, you rarely see them. You rarely see such cases because of the stigma. But you wouldn't say that they are not there. Once in a while, we usually get clients, but these are only the ones maybe who voluntarily come. But there is stigma. There is stigma.
What would your suggestion be as an expert, perhaps, as regards to inmates who are going through these very difficult situations of violence, and they feel like it's a normal thing?
Yeah, what should be done is the sensitization again. We would be involved also to go to the prisons and do sensitization to them, and to make them understand what the consequences of what is followed after any of the SGBV is done, or any of the violence is done. What is expected of them? Because maybe some they don't know what would follow. Some they don't know that they can contract diseases like the STDs and HIV, even pregnancy. So it is we need to do sensitization to them to get to know that they need to seek for treatment. Yes, yeah.
Any point that you wish to also echo on the same regarding this whole issue, this topic of SGBV?
Okay.
And especially getting to Maine, why they're not coming out.
Okay. My name is Moses Ambili, clinical psychologist. The issue of gender-based violence of the recent past has been on rise, especially during this pandemic, and there are major challenges and efforts that needs to be taken, especially in terms of sensitization, and also in terms of the structures and the facilities to enable have a clear service delivery for the gender-based violence issues, not only to sexual gender-based violence, but also to physical violence, also is on the rise. For example, in a good clinical setup, we need a 360-degree approach of service delivery. And this one will be possible if we have the services delivered under one roof. Will help to minimize the level of stigma. We need more resources, more structures, and in particular, we need these services to be provided under one roof, in particular health center or facility offering SGBV services. Yes.
I mean, what is the impact of SGBV on the mental health of most of the victims?
Okay. SGBV also has effects on the mental health to the victims, not only to the victims, but also we have the survivors and the perpetrators. For instance, it comes with trauma and stress. Yeah, trauma is one of the mental health factors that comes when one goes through violence, such as rape, and also physical violence. Yes.
So what needs to be done, perhaps? Or is it, should it be part of the 360 provision of services that you're talking about?
Yes, obvious. Mental health service must be included in the 360-degree approach in offering of the SGBV patient. That's why we must have psychologists or the counselors to offer trauma counseling to such individuals. Yes.
Thank you very much. Any point that was missed out? Thank you very much for the